So I am here to talk about annual open enrollment for Medicare, and my name is Joan Adler. I am an NVN member, and I am also a member of an organization called PA Medi, which formerly was called a prize. And okay, so a prize is, PA Medi is part of a national organization that's called SHIP, the State Health Insurance Assistance Programs. We are federally funded entities that are funded through the state departments on aging, and then it goes to the local area aging agencies. So we get money through PCA. And we used to be called a prize, but they changed our name to PA Medi. We are a bunch of counselors. And each state is allowed to give their SHIP program a name if they want to. Most states, they're just called SHIP. In our state, we are now on our second name. And we provide free and unbiased Medicare counseling. We're a not-for-profit agency. We are primarily volunteers who are very well trained in Medicare, and we try to assist people in making their choices. We are not associated with any insurance plans. We don't get paid for signing people up. Generally, we work either in the office, rarely now, or from home. We're available primarily for one-to-one consultations and counseling with people about their individual situation, but we also make presentations. There may be times when no one is able to answer the phone, so we ask that people leave a name and number and a brief message, and we call people back. Everything we talk about with you is kept private and confidential, and our primary interest is to assist you in making the best choices for you. So we are now in a period of time that's called annual open enrollment or fall open enrollment. And, oh goodness, I have so many things interfering. Okay, so fall open enrollment occurs every year the same time. It occurs from October 15th to December 7th. And during this time, people who are already on Medicare can make changes to their health insurance coverage. So this is not really a time for new people to join, although sometimes new people join at this time of the year. But open enrollment is generally for people who have plans to change their plans. It's important to check because a lot of times your plan is going to change from one year to the next, and it may not be the best plan for you in the coming year. So this is the time that you can do various things. You can join a new Medicare Advantage plan if you have an Advantage plan, or if you have a Part D drug plan, it's a good time to check that you're still going to be getting the best deal for the coming year. It is a time that people can switch from original Medicare to Medicare Advantage, or they can switch from Medicare Advantage to original Medicare. But regardless of how you get your Medicare coverage, you should always consider your access to the providers that you want to keep seeing, your access to your pharmacies, any special benefits that you need, and the total costs that you will be paying in terms of insurance premiums or deductions or cost sharing. So when people try to change their plan, they're encouraged to use the Plan Finder, the Medicare Plan Finder, which is easy to get to, but not necessarily, well, I can't get to it right now, it seems. But not always easy to navigate. So it's always good to have a professional help you do it. And that's what we're here for. So if anybody has questions, specific questions about Medicare, I think that most of the NVN members know that I'm the person to call if you have questions about Medicare. I also can do the actual changing of plans for you. But I can certainly finesse the system a little. And this year, for various reasons, there are a lot of differences with plans, particularly with drug plans. Some of these changes are because of recent laws that have occurred, and I'm going to go over that. And some of them are because of changes that are going to take place in the future, and some plans are just trying to get their last licks in of unregulated price increases and things like that. So let's talk a little bit about what the new issues are. Okay, so the first thing is the Biden Inflation Reduction Act, and I'm not going to talk about every little thing that happened, but I'm going to talk about the things that are particularly relevant to us as Medicare users. I'm also going to close my door so that you don't hear my dog bark. Okay, so these are some of the things that are happening, and some of them have started already in 2022, and some of them are going to start in 2023, and then there are more changes for the future, but I'm not going to go into those because they don't really apply at this point. So as of now, as of October 1st, this is the start of the first 12-month period for which the drug manufacturers will be required to pay rebates to Medicare if their prices for certain drugs increase faster than the rate of inflation over the last 12-month period. And this is important because it is going to be putting a control on the drug companies as to how much they can raise their prices in the future, and that's starting now. A really big thing for people who take insulin is the new insulin cost sharing. So you may have heard that the caps on insulin prices are going to be capped at $35 for a month's supply of each insulin. And starting January 1st, the insulin prices will be capped to people that are getting their insulin from a Part D drug prescription at the drugstore. And also the Part D deductibles will not be applied to your insulin costs. So that is a really big deal for people who have insulin, whose insulin has been very high priced in the past. And this is really a very good thing. Now, not everybody gets their insulin at the drugstore. Some people get their insulin and use it with a pump. So the people who are getting insulin through the pump, their insulin prices are not going to be capped until July. But then they will also not pay more than $35 for a month's supply of insulin that they're using in their pump. And this will, again, not have a deductible applied to it. Also a big one, starting January 1st, all adult vaccines recommended by the advisory committee to the CDC will be covered completely by Medicare. And this applies primarily and greatly to shingles. So anybody who has not had a shingles vaccine yet should not get it this year, because this year it's still a Part D item and it's very expensive. It's been very expensive to get shingles on Medicare. But now, as of January 1st, it's going to be free. So anybody that hasn't had their shingles vaccine should definitely get it, but wait till January 1st. Also effective next year, again, Medicare Part B drug rebates manufacturers will be required to pay rebates to Medicare if the prices of certain Part B drugs are increasing too fast. And Part B drugs include anything that is given in a doctor's office, anything that's infused at an infusion center, any injectable drug that would not normally be injected by the patient themselves. So this applies to things like Prolia and other osteoporosis medications, which are Part B drugs, because you do not go to the drugstore to get them and then give it to yourself. So this is very important. There will be a limit to how high the increases for these drugs can be. Also, co-insurance for Part B drugs. There will be lower co-insurance for some Part B drugs, again, if the drug's price increased faster than the rate of inflation. And starting in September of next year, the CMS will announce the first 10 Medicare Part D drugs that will be selected for drug negotiation. And as you may have heard in the news, Medicare is now going to be allowed to negotiate prices for medications. And everybody has been pushing for this for years because everybody knows that you have a huge volume of people buying a drug, you should be able to negotiate a lower price. So finally, Medicare is going to be allowed to do that, and probably will not go into effect until 2026, but they will at least be announcing the first 10 Part D drugs that are going to be negotiated. We already said that. I went backwards. Okay. The other thing that is happening is the more of the BENIS Act is going to go into effect, and this is the Beneficiary Enrollment Notification and Eligibility Simplification Act of 2020. So Medicare is so complicated that people sometimes don't know when to enroll, or they get the wrong information about enrollment, or they're told they don't have to enroll, and then they miss their enrollment period and they have to wait, and then after they enroll, they still have to wait for it to go into effect, and it's all way too complicated, and a lot of seniors have gotten caught up in all the confusion about Medicare. So this BENIS Act was passed, and it applies in various situations. I'm going backwards again. So there are various enrollment periods that people have when they start Medicare. So we all know about the initial enrollment period, which if you are not working when you turn 65, you need to sign up for Medicare during your initial enrollment period. And your initial enrollment period starts the 3 months before the month of your birth, plus the month of your birth, plus 3 months after the month of your birth. And this is when you sign up. And generally, if people sign up in the early part of their eligibility, their Medicare will start on their birthday month, the first day of their birthday month. But some people, for whatever reason, don't sign up early, and they wait until the last part of the initial enrollment period. And when that happens, sometimes their Medicare is delayed in starting for 2 or 3 months. But as of January 1st, there will be no more coverage delays in Part B, which means that the effective date will be the first of the month following when you sign up, regardless of, well, it won't start before your birthday month, but if you sign up at the end of your initial enrollment period, it will start the month following the day you sign up. So this is a very good thing. It helps a lot of people not have their Medicare delayed. Now, some people miss their initial enrollment period and they're not working, because people who are working don't have to sign up. They get a special enrollment period when they stop working. But if you miss your initial enrollment period, then the time that you can sign up is called the general enrollment period, and that occurs in the first quarter of every year, January, February, or March. But it used to be that if you signed up during this part of the year, you had to wait until July for your Medicare to start. But that's not going to happen anymore. Now, if you sign up during the general enrollment period, again, your effective date for Medicare will be the first of the following month. In addition to all the special enrollment periods that occur now for people who are coming off of work insurance, or people who are coming off of retirement insurance, or people who are coming from out of state or losing their insurance for other reasons, there's going to be more flexibility and more circumstances in which people will be allowed to have a special enrollment period. And in particular, the circumstances where an employer might have misled a beneficiary about needing to enroll, or somebody may have gotten inaccurate information from a government agency. So if that happens now, people are going to be granted a special enrollment period where they can enroll and not have to wait, another year to come around to enroll in the general enrollment period. This applies a lot to people who had city 5-year retirement plans. Some of the unions and some of the counselors would tell people that they did not have to get Part B because their insurance was good enough and they didn't need Part B. And that, that's their opinion, but that is not the opinion of Medicare. And then when these people came off of the city 5-year retirement insurance, they had a 5-year penalty for a late Part B enrollment. So problems like this are what has contributed to the change in the law. So this is my name and number if people want to contact me. I just have a few more off-the-cuff things to say, especially about some of the Part D issues. So there are more rules that are coming up in 2023, 24, and 25, all of which are going to regulate and cap increases in drug prices, increases in premium costs, increases in copays. And so this year, there seems to be a lot of plans that have decided to get their last licks, and some plans have really dramatically raised their premiums. A lot of plans have increased their drug prices. And as I help people get new plans, I have noticed that sometimes you can get a better drug price on GoodRx. So if people don't know about GoodRx, it's an app. You can go there on your computer. You can get the app on your phone. If you watch TV, you see all these people going into the drugstore and showing the pharmacist their phone with the GoodRx price, and you will get the cheaper price, and then you don't have to buy whatever particular drug it is through your drug plan. You can get it through GoodRx instead. And you don't have to be a member. You don't have to pay anything. You just download the app or look it up on your computer. If you're on your computer, you can print out a coupon that you take to the drugstore. If it's on your phone, you just hold up your phone at the pharmacy and show the pharmacist what the price is. And actually the pharmacists, nobody knows this, but they were under a gag rule until last year, I believe. They were not allowed to tell us if there was a cheaper way to get our medicines. But that gag rule was eliminated last year, and now the pharmacists can actually help by suggesting or even looking up prices on GoodRx or any other price. And in addition, I've been told if you offer to pay cash at the pharmacy, you might even get a lower price than GoodRx. So these are the mainly the important things about Medicare that are changing. I would encourage everybody to check out their plans for next year, because, you know, if you didn't look at your letter of benefits, some of the drug plans have tripled their monthly premium. Some of them have increased prices for some of the drugs you're taking to be extremely high. And this is information you need to know because none of us has money to burn. So I am open for questions. If anybody has any questions, either about this or about anything else about Medicare, please feel free to ask.
Can you put your contact information up again?
Yes.
Thank you. Oh, it just went away. There we go.
No, I'm trying to get it and I'm trying to make it big at the same time. I have to do this carefully. It doesn't want me to do it too fast. There it is. So this is my contact information. Some of the people who are at this meeting have already contacted me. Oh, yes, I just want to say, not a big deal, but the Part B premium for next year is going down from $170.10 to $164.90, or as I like to call it, $165. And the Part B annual deductible is going down from $233 to $266. Not a big deal, but at least it's not going up. And there are various other price changes that you will find out as it applies to you. But yeah.
So also I'd like your opinion on something else, and that is
Sure.
when we first signed up for Medicare, which was earlier this year, we used one of the independent consultants who analyzed what our, what drugs we take and so forth and so on, and made very specific recommendations about what's the
Yes.
the best Part D plan for us. And they have recently redone that analysis, and it turns out, according to them, that the plan we're on, we're each on different plans, but the plans we're on remain the best for us. Is that the kind of analysis that you do, or is that something beyond?
Yeah, I don't want to betray anybody's secrets, but that's no analysis. You just go into the Medicare plan finder. I can show you that if I can get this, if I don't have too many things open on my computer. So give me a minute and I will try to show you how that works. I'm happy to show anybody how that works. So let me see if I can share my screen. Yeah, here we go. Okay, so this is the Medicare plan finder. So I just want to say something about consultants and agents and representatives. They're all salespeople. Even brokers. Brokers work a little bit more for you because they work with a lot of different companies. But mostly all these people that you talk to, they may be independent contractors in that they are not working for a particular company, but they all have axes to grind one way or another. So if you're lucky, you get an honest person that you're working with, but if you're not lucky, you're just getting a salesman who works for a specific company who gets paid by steering you to that company. Now, this is the Medicare.gov website. And when you go in to find plans, you can go in with your own login if you have a username and password, or you can go in as just an anonymous person who lives in one of our zip codes. And you say what you're looking at, and you say, I want a Part D drug plan. And then you press start. And it asks you if you get any help from any programs. And it asks you if you want to see the prices. Of course you do. And then you put in a bunch of drugs. So I usually put in, let's say, Lipitor. and then you click it, and then it says there's a generic. So you say add generic, you put in your dosage and your how many pills you use a month. And if somebody wants to shout out a drug, I'm happy to put it in. Putting in metformin, which is a very common drug. I'm going to put in, let's see, something for high blood pressure, Cinepril. And then let's put in something expensive. Somebody have an expensive drug they'd like to look up here?
You could put in Brio.
Sounds good.
It's expensive.
Right. Okay, and let me put in, oh, this has a generic. Let's put in Januvia. That's an expensive one. All right, so this is the analysis that you do. The analysis is called, well, okay, add to the drug list. So now we're done with the drug list. We say we're done adding drugs, and then they want us to pick pharmacies. Now, the trick to this is to pick all of the big pharmacies because every drug plan works with different pharmacies. And if you put in all the big ones, you'll get the range of prices. So I like to put in mail order, Save On, CVS, and Walgreens. If somebody has another favorite pharmacy, we can put that in. If we're not using our zip code, you can find Costco and stuff like that. And it doesn't have to be your exact pharmacy because they all have computers. So that's, we could put in
Rite Aid. Rite Aid.
Okay. So then you get 5. I gotta move you out of the way. You get a choice of 5. You can add them all to your list. And then the analysis is this. It goes to the plan page and you select lowest drug and premium cost, because that will tell you your out of pocket for both your premiums and the drugs for the rest of the year. And then they tell you if you're on a plan, your plan will show up first. And if you're not on a plan, they are listed so that the lowest plan shows up first. And you can see these go upward of $6,000. Okay. So why is it so expensive? Well, let's look. You go to plan details, and this is what they're calling analysis, but they're really just using the plan finder, and you could use that too.
So is what you're saying is that going through this on Medicare.gov will give us essentially the same information that a consultant would be able to give us? Yes,
but the but is, I'll show you. So then you get the first plan was the cheapest plan was this WellCare plan. And then it tells you what pharmacies are in the network and which are preferred. And if you have out of network pharmacies, it'll say that too. Now, it used to be that the preferred pharmacies were the cheapest, but that's not true this year. So sometimes you look at the numbers. Well, these numbers are all pretty much the same. And so sometimes there has been an in-network non-preferred pharmacy that was cheaper. So you have to look at that. And then you go to the bottom and you can look at whatever your drugstore is. So say you go to Save On. You can see what you would pay monthly, and you can see if there's a deductible, if you're paying the deductible, how much you're going to pay for your drugs. Now, we've got actually 2 very expensive drugs on here. One is the Brio, which is also known as fluticasone vilanterol, and the other is Januvia. So these are very expensive. So I would go to the good old GoodRx. This is what it looks like on the computer. you put in your medication. And it will show you how much it costs at different places. So, you know, your Part D plan was going to charge you what? $429 a month. But if you go on GoodRx, you can get it at Walgreens for $172 a month. Or if you go to Acme, they'll give you it. Well, that's too high anyway. But so you can find the pharmacy that sells it for the cheapest. So I would, if this was my drug list, I would not order my Brio from the Part D. I would order it. I would go into Walgreens and get it at Walgreens. Sometimes it's, you know, it doesn't work like that. So let's look at Januvia. So Januvia is about $500 a month on your Part D plan. And it's about the same even on GoodRx. So if you're on a very high price drug, there are ways that you can help defer those costs, and we can refer you to places, or we can evaluate you and see if you're eligible for any low cost support like PACE or PaceNet. There's various programs that people are eligible that we can check your eligibility and tell you how to enroll. But this is the analysis. It's not, you know, they're not taking their higher executive functioning to analyze this. They're just looking at this tool, which is available to you. Now, if you can go on there and you find yourself that you're taking just a whole bunch of low-cost generics, and the cheapest plan for you is the one that costs $5.20 a month, go for it. Then you don't need my help. But if you find that there are higher prices and you want to know if you can do anything about it, or if you want to know how to play with the system a little bit, you know, that's what I will help you with. And then I can just enroll you right there, or you can enroll yourself right there on the screen. There's always a button that says enroll.
If I could just say something, you know, I don't have all the exact right words, but when you were, Joan, when you were talking about agents and those folks that don't really sound like salespeople, but may have a stake in one particular company over another, I just want everybody to know that I have asked for Joan's help, I think, for 5 years. Every November to try to find me the best drug plan, and she has never failed me. And she has no. When she started the presentation, she said, you know, the folks that do the work that she does as a volunteer, that they are not beholden to any drug company or to any plan or to anything. They are doing this to try to get us the best we can for our money. And so Joan is totally non-biased and incredibly knowledgeable.
I won't say I'm unbiased, but I'm biased in your favor.
Right.
I have my biases. We all have biases. But yes, that's what we just really try to get you the best plan possible. Because it is so confusing. Medicare is just a mess. And I don't know, you're all as old as me. So, you know, Medicare came in different parts. And different parts got passed in different years, and the different parts have different rules, and somehow they fit it all together and make it into a very confusing system. So if you can master the plan finder, you can try this at home. But if you want to just get some reassurance, you can also give me a call.
Joan, you said that we could, and you showed us how, get the same information that agents could do. You said agents could do that. You can do what agents do, but there was a but there, and I don't know that you.
Well, the but is that, you know, there are certain tricks that you can use to make sure, and I've told you some of the tricks. You know, if you go into the plan finder and the agent says to you, well, what's your favorite pharmacy? And you say CVS. And they just put CVS in there. And they don't put in CVS, Rite Aid, Save-On, Walgreens. Then you get the CVS price, but the Walgreens price might be cheaper. But they're not looking at that for you. You know, that's one of the tricks. You know, the other thing is to look at GoodRx. The other thing is to take off certain, like if you decide that you're going to buy your Brio at, let's go back to that plan. So this is, we're talking $6,000 for the year. That's pretty hefty. So you may decide to go back and get your Brio through GoodRx. So then you would take off your Brio off your drug list. And then when you go back to look at plans, it might be a completely different drug plan that comes up as the cheapest. But now we're down to $1,200 for the year and an $11 monthly premium.
Right.
So, you know, that's another trick. I mean, there are a lot of tricks that it's like any system. The more you use the system, the more you know how to work around it. So that's my contribution. The plan finder is not the easiest thing to use. And like I said, if you go in and you do it yourself and you just want someone to say that what you did was fine, give me a call and I'll go in and, you know, see if I can get a different result. And the agents, like I said, they're all salespeople. So if you're on the phone with an agent is a person who works with one insurance company. A broker is a person that works with a lot of different companies, and they are more likely to work on your behalf, but they all get paid for signing you up. So you don't pay them. The agent only gets paid if you buy the product from their company. So they're not going to tell you about products from other companies because it's not in their interest. The broker also gets paid for signing you up, and they are motivated to sell you a higher priced product so that they get more money. But I have like a list of reliable brokers who have sworn to work in your behalf and are not going to upsell you. So, you know, everybody's trying to make a buck. You just, you know, they call themselves representatives. They're not, they're salespeople. Medigap. So yes, Sarah. So that's the thing about Medigap. You buy Medigap through an insurance broker. And let me go back to the internet. So I send you to this tool, which is called MedicareSup.org. This is on the internet. You can go there. And then these are brokers who work with lots of different companies and have sworn to work in your behalf. So you click the thing that says request a quote. And it takes you to another page where you put in your zip code. And then you click, and then you will get a list of brokers, even though they call themselves agents. They're brokers, and they've sworn to work in your behalf. And I have never had any complaints about any of these people. Some of them work with PA Medi. They teach us what they know. We're not really allowed to refer you to a person, but we can refer you to this website where you can get a list of reliable people to sell you a Medigap. Did that answer Sarah's question?
Yes, I got a plan several years ago through, but I can't remember the organization. But I didn't know whether all of them were done that way. So that answers the question. I will leave it where it is.
Yes.
It's going up a lot each year, even it isn't a year plan. I mean, in other words, it can go, it seems to be able to go up at any time, the cost.
Well, the Medigaps do go up a little bit every year. The benefit of getting a Medigap when you start Medicare is that you get what's called guaranteed issue, where they are not allowed to ask you any questions about pre-existing conditions. The only question about your health that they can ask is, do you smoke? But later on in life, if you have a Medigap and it's been going up in price, and if you're pretty much healthy, which means you don't have any serious, debilitating, chronic, costly diseases, there's always a chance that you could buy back into the system at a lower rate. So if it's getting too high and you're in pretty good health, give me a call. And because we have the tool that the insurance brokers use. So we can look up the prices of the different Medigap plans. It's the same tool that they use
Great.
through the Department of Aging. So. And then we also talk to people about low-income program eligibilities, and then we talk about the IRMA for those high earners out there who are making a lot of money and have to pay extra for their Medicare. We talk, whatever it is, we pretty much know or have resources that we can direct you to for answers about Medicare. So I'm just going to put my information up here one more time. And if anybody needs me, just give me a call or shoot me an email.